just take down the guardrails. Who cares if we're messy and difficult? We deserve to take up room. Welcome to FEM MD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at the Hippocratic-collective.com. I'm Lauren Umstattd. I was born and raised in Kansas City. I am a facial plastic surgeon. I opened my own business almost 3 years ago. I'm married. I have 2 children. Personality-wise, I'm a little bit different than kind of your average duck. I think that's what makes life interesting, is that we're all wired so differently. And I think over the past probably 2 to 3 years, I've really gotten to know myself much better. It just makes more sense when you have the lens of self-understanding. I crave weird conversations. I crave complexity. I crave dirty, messy situations. I literally hate talking about the weather. I hate talking about upcoming holiday plans. I want to skip past all of that. I want to talk about your divorce. I want to talk about when you did something you were horribly embarrassed about. I want to talk about the hardest part of your life. I think that as women, we deserve to have a community of support, because it's such a unique experience, especially working in medicine, trying to run a household. I think that me as an individual, I'm such a challenger of the norm. I don't ever like listening to authority. I don't want anybody to tell me what to do. I think that I'm the best decision maker of my own destiny. And I wish every woman had the confidence to say that. This is hard to say out loud, but I would say being a mom is not super natural to me. I recently was visiting a colleague, watching her operate, trying to learn some of her surgical technique. And it was interesting because I asked her, how do you refill your cup on days when you feel just so exhausted, so challenged by the business side, the surgical side? How do you recoup? And she said, oh, spending time with my kids fills my cup. And I was like, what? I need to channel that energy, because I have 2 young children. They're both boys, super energetic. And I almost feel like when I leave work, I'm getting ready for my second job. And I love them to death. They're the best thing that's ever happened to me, but they deplete my cup right now, which I think a lot of women are hesitant to say. I think any mother, certainly any working mother, feels a lot of guilt, potentially shame around how she parents, how much time she spends with her children. There's no perfect parent out there. Parenting is one of the hardest jobs because there is no right or wrong. Whereas in surgery, things are very clear. You either did it right or you didn't, although there's some grayness to that. It's not quite black and white. But parenting is way more gray in my mind. What is failure as a parent? What percentage of failure should we tolerate? How do we flip the coin and say, oh, it's good that I did this to my kid because next time I can do this? I've not yet made that translation yet, but I'm only 36 and I've got a lot of years to get better. I would say my marriage is fairly non-traditional in the fact that he helps so much more than the traditional husband would with a lot of the parenting roles. And I am really incredibly grateful for that. He's a wonderful husband, a great dad. And if I think back to way before when we even had children and we were thinking about having kids, it was funny because I am very um, distinct and percentage, and I don't know how my brain works, but I told him, if you're ready to have kids, I'm in residency. You are going to be 100% dad and probably 75% mom. And then I will be 25% mom, if you think about things in math language. And he was like, yeah, I think that'll work. And so I was like, okay. And that's exactly how it played out. He basically raised our son for the first year of his life because I was working just an insane amount of hours. I was never home. Most parents are excited when their child sleeps through the night for the first time. I cried because I didn't get to see him, because sometimes overnight was really the only time I would see him, our first son, when he would wake up and I'd feed him. So when he slept through the night the very first time, I didn't get to see him that night or the next morning. I went over 24 hours without seeing him for me, which was horrible. But as I've gone through training, my career has changed quite a bit. I would say it's more if we think of it as a collective 200% of parenting, I would say it's much more balanced now. I would say my husband's about 110% and I'm probably 90%. I think so much of our life is serendipitous. When I started out, when I was a teenager, I never thought I would own my own business or be a facial plastic surgeon. I just always like hard things. I like challenges. And so when I was thinking about what do I want to do after high school, I didn't want like an easy job. I was like, what's the most complex thing I could do? Well, being a doctor seems like really complex. So I went into head and neck surgery, again, not knowing I was going to fall in love with the niche field of facial plastic surgery. But then in residency, you get exposed to a lot of different areas within the head and neck. So we do like ear only surgery, throat only surgery, face only cosmetic surgery. And when I did my rotation with face only cosmetic surgeon, I was like, that's it. I have found my calling. I love the patients. I love coming to work. You get to do fun things every day. There are no sad days when people are getting facelifts. I would say the boldest move I ever made was opening this business. I had no reason to believe it wouldn't succeed. Whereas a lot of people are like, what do you mean you're opening a business? You have no business background, no accounting background. You've never designed like a surgery center. You've never led a team of healthcare individuals. And I was like, well, what do you mean? Like other people do it. Certainly I can do it. And I think looking at some of the other people out there who do what I do that are older than me and who are assholes, I'm like, if they can do it, I can do it. There's no magic sauce, no magic wand, no magic pill. You just do it one step at a time. And I think if there's any person to bet on, it's yourself. I think vulnerability is a super important topic to discuss. And I would say that for me personally, I dislike being vulnerable. When I think about my career choice, I think back to when I went in for my very first rhinoplasty consultation. I've had a rhinoplasty. And I remember sitting down with this like random guy that I had never met and literally talking to him about the biggest insecurity on my face. It was very awkward and I felt like very inhibited in what I wanted to actually tell him. I think when you think about the body, head and neck surgery is one of the more high stakes areas to operate on. There's just a lot of important anatomic structures. I also think from a person and human standpoint, head and neck surgery is it's an intimate area to be working on a patient. Whether you're doing cosmetic surgery and changing their appearance, which is a huge deal, or a functional surgery where you're altering patients' ability to communicate, to swallow, to hear, to interact with the world. And again, with the whole challenge thing and hard things, I liked operating in an area that was very high stakes. Surgery is such a wild experience. You're literally taking a scalpel and cutting into somebody, which in the operating room is considered like something very cool. But if I were to do that like in regular life, that would be, like a horror film. Our very first experience with actually taking a scalpel to a body was in medical school in the anatomy lab. And I think every medical student will tell you that you've like vividly remember meeting the person that donated their life to science. And I think, I'll speak for all of us. We are incredibly grateful for those individuals who did that. That is a gift that, I'll forever be grateful for. The first time you slice into flesh, it is wild. It feels so wrong. It feels wrong for months. And then you slowly get desensitized. And that's on a dead body. Like there's no bleeding. They're obviously not feeling any pain. There's nobody there. You don't have to take care of them afterwards. I think becoming a surgeon is so much about progressive desensitization. And so in medical school, you're working on donors. Then you graduate to residency where you're observing like live surgery, where your bosses are cutting into humans and fixing things that are wrong or helping the patient in a functional way or sometimes cosmetic way. During surgical training, you kind of slowly graduate to become from the observer to the surgeon. And by the end of residency, you're fully on board with being the entire surgeon for a case. And oftentimes the roles have completely flipped to where your boss is standing behind you, not scrubbed in and observing you. I think the hardest part for me progressively during training was I like operating on people when they are fully asleep so that I know that they're not feeling any like pain, discomfort, suffering. That's where the anesthesia colleagues come in who are amazing at what they do. What I didn't like during residency is like doing awake procedures on patients, knowing that I was causing them pretty significant pain. For example, people come in with like an infection and you just really have to kind of like get the infection open. So it's really quick. It doesn't warrant an entire trip to an operating room. And for all those people out there that are in healthcare, you know that infected tissue is really hard to numb. You often can't get them super numb because of all the like bad infection stuff that's in there. So that was kind of another like progressive jump in desensitization. First is the donor, then it's a live human who's totally asleep under anesthesia. Then it's doing something to someone awake and kind of walking him through, like, take a deep breath. It's just going to take a few seconds. And then the next huge step is being totally in charge of everything. Like, it all falls onto you once you're done with training. There's no like safety backup, anybody you can call. And so now I find surgery exhilarating. I get super excited on surgery days. I love what I do in that there's so many challenges. Like, you think about a face and it has two sides. Oftentimes when I sit down in consultation with people, they say, how long is the surgery? And I tell them 4, 5, 6, hours, depending on what all we're going to do. And they're like, what? Why the heck is it, 5 hours long? And I say, well, you've got 2 upper lids, 2 lower lids, 2 cheeks, 1 neck. You just have to take things one at a time. But I really find surgery exhilarating, which is kind of weird to say. As a facial plastic surgeon, the most common thing that people come to me for is I just look old and I want to look like I feel. I don't feel old. I just want to look like myself. And oftentimes we'll look back at pictures of them from, 10, 15, 20 years ago. And that kind of helps me. It's like a puzzle, like a little investigative project where it's like, well, every woman ages somewhat similarly, but there are differences. So a lot of people will say, I feel like my brows have dropped. I feel like I have extra skin on my eyelids. I feel like I just overall look tired, and I'm not tired. I feel like gravity has like pulled down my jowls, all of this hangy stuff under my neck I can't stand. The way I feel and the way I look just don't match. I often will weed people out who have these unrealistic, kind of weird, dysmorphic things that they want. People are like, I hate my entire face and I want a new one. I say, wow, this clearly is not like a good candidate for surgery. The good candidates for surgery are people that say, I just want to look like I did 10 years ago. And I say, perfect. Let's talk about what you did look like 10 years ago and think about refreshing you, through surgery, plus or minus some non-surgical stuff, and then get you back to where you once were. Certainly, I think one of the most shocking things to patients is that I did quit my fellowship. And for a long time, I was very reticent to talk about it. But then on the flip side, I didn't want patients to find that out on their own. I think that it's my duty to talk about it for 2 reasons. One is so that patients know, like, my story. I think that patients deserve to know the credentials, training, age, whatever, of their healthcare professional, whether it's your surgeon, your primary care doctor, whatever. So I felt like it was my duty to put all this out there so that patients know. I have had a lot of ugly moments in like med school, residency, certainly fellowship, like every day felt ugly opening this business. I think one thing that I have to tell myself pretty much routinely, I don't know about daily, but definitely weekly, is that failure is good. Challenge is good. When it's hard, it's good. A failure in surgery is devastating. For me, fortunately, failure is like, it's not quite perfect. It's not like someone died. It's the patient doesn't love their outcome. But you know what? That's good because I'm early in my career and I want to get better. I have to tell myself that these little failures or these little imperfections, perfect thing is that I have the tools and resources and oftentimes the relationship with patients to go back and make it more perfect. It's never going to be perfect. I hate using that word. But if there are true things that we can improve upon, me and the patient sit down and we say, yeah, was this a total failure? No, because we don't have any like horrendous outcomes here. But can we make it better? I do think we can. And so for the first year or two, I was like, oh my God, I totally failed. Like, she hates her outcome. I don't like her outcome. It's not as good as I want it to be. But I've had to totally flip that in my mind and say, you know what? These little opportunities to do tweaks, to do little tiny revisions, that's what's going to make me better in the long run. Like, ultimately, that's going to improve my success rate. And then I think, personally, one of my goals for this year is I'm going to take that approach to parenting because I think at home, for some reason, it's much more complex to me. And I don't know why that is. And so one of my goals is just to like bring these like weird, dirty conversations to the forefront. One, for you to feel like you're not alone. And 2, to help build the confidence of like, we should all just be who we are deep down, like our primal selves. Like, that's who we need to be in real life. And I think we'll feel like just so much more joy every day. Thanks again for tuning into FEM MD. And remember, the world belongs to the women who question it.